Welcome back. I'm here with Gerald Comissiong. He's the CEO of Todos Medical. Gerald, it's been quite a few days since we've been able to speak with you. Several holidays in the rearview mirror, but really excited to have you back. How are you doing today?
I'm doing great, thanks. How are you?
Doing really well. Excited to have you here. Always a good conversation. What's going on with COVID right now? We've had Fauci warning us over the weekend to expect more infections, obviously a large run rate right now. The United States setting a record for the number of new infections in one day. How do we know that number is accurate when the FDA is warning us about antigen tests? And what do you see the COVID situation being right now?
Okay, well, first and foremost, the number is not accurate. We all know that people have lateral flow antigen tests, and we see them on Twitter every day. Many people are testing positive, and none of that data is captured. So there's a lot more spread going on. There's a lot more community spread. And some of the dangers, of course, is that, a lot of these lateral flow antigen tests, while they say they're negative, in fact, sometimes they're positive. The biology is just not catching it. And so, that's a major issue. So with regards to COVID, there's, exponential spread. We've seen the guidelines being reduced for quarantine from 10 days to 5 days, regardless of vaccination status, which is a giant shift away from what we've been hearing over the last year to 2 years. This is really an experiment right now. We're finding out, we're going to find out with real world data what happens when you let this virus spread and you don't try and cut the chains of infection. And I suspect what's going to happen is we're going to find out that there's a whole lot of long COVID, even if there's not as much acute hospitalization and death. And so we have to prepare for this. And this is one of the big reasons why pills are not just about avoiding hospitalization and death. The pills associated with COVID, like Artolavir, are really need to be focused on getting the virus out of the system entirely, because we're finding that people at autopsy have tons of virus, even if they were asymptomatic or even if they had mild symptoms. And so we don't know what kind of contributing factor the virus is having to overall health.
Got it. No, great clarity there. And of course, this week, when you're talking about the testing, you just announced the record PCR testing volumes from the Provista lab. So maybe you can give us a little more detail on the numbers there. Talk about the cash flow on the testing business side of things.
Yeah, sure. So from a high watermark perspective, we got in over 4,000 samples in a day now. So that's the high watermark, but we're definitely averaging over 1,000. So, we see that as a big revenue driver, and our strategy is coming together because many labs that don't have automation, who can't meet the turnaround times, are now coming to us for overflow. And we're also, because many frustrated customers have been at, not necessarily those labs, but similar labs, they're looking for a new home to be able to give fast turnaround time. So that's great for us. Our biggest challenge in meeting that, increasing demand is hiring enough people. So we just hired a new GM, and we will be announcing that in the early part of January. A guy with a ton of experience and a big time background, and he's bringing on a lot of lab techs and accessioners to be able to meet the increasing demand that we have going on. So, in terms of testing volumes, that's where things are headed. It's definitely heading north. In terms of revenues, the thing about it is typically you align the payment structures, whether it's from insurance, of course, or whether it's from another lab, to when those labs actually get paid by governments, so, or insurance companies, whoever they get paid. So for us, we have a lot of revenue hitting the books, a lot of accounts receivable. That money is starting to trickle in, from previous work. And now as this work is expanding, we expect revenues to be up, and then cash flow to start to really be positively impacted in the January, February timeframe. And we think that, this has a lot of room to run, because unlike last year, where there was a change in administration and therefore a change in strategy, Biden came in and really focused on the vaccination campaign at the expense of testing. That, decision has really challenged the government now, and they're really being taken to task for the lack of testing availability. So they're going to be very mindful of this, especially heading into midterm elections next year. I believe they're going to buttress and fortify that testing infrastructure, and that is needed with these new pills, because you cannot get a prescription for Paxlovid or for Molnupiravir unless you test positive, and not just test positive on a lateral flow at home, test positive with a lab report, whether it's antigen or from a physician, antigen or PCR, and then a prescription. And that, a physician is not going to prescribe these two drugs without a positive test from a lab. or their own point of care, infrastructure.
Absolutely. And then, of course, when you're talking about the revenue side of things, it looks like you've added some new talent to the marketing arm. You've brought in a heavy hitter in the area of AI. And you actually just tweeted out that you had record daily sales of Tolavid, but didn't really share the numbers on that side of things. Can you fill us in on how the sales have been going? And do you think that new marketing team and the additions you've made are responsible for the increases?
I think there's a couple things responsible. Obviously, I think the team we're bringing on is quite good. So we hit a high water mark of over $80,000 in a day in sales, and had a couple of days in that space. It came down. That was about a week, a little over a week before Christmas. It came down a little bit, but it's settling much higher than it was before, in the tens of thousands of dollars per day, and that's effectively with no marketing. So now that we do have marketing in place, and we've got an AI group that is really helping us drive our marketing strategy, we think that there's a lot of potential, because we're building those personas to go after of people who are on the web searching for solutions. And with Paxlovid's approval, and a lot of the the excitement around that, people have started to dig into the biology of 3-cell protease, and so there's interest now, and there's sort of an understanding that 3-cell protease inhibitors are really very important, and so we think that message really around the FDA authorized claim that we have for Tolavid, not around COVID, because we cannot market COVID, because Tolavid is not approved to diagnose, treat, prevent, or cure any disease, including COVID, but it is authorized as a 3-cell protease inhibitor. As people understand what the 3-cell protease is and how some of these other products out there in the marketplace have been working, I think the fact that Tolavid and Tolavid Daily are 3-cell protease inhibitors with approved claims, unlike some of these other products, and are very safe, is really what's driving the attention towards that. And I think as people understand that, and gain a better understanding of how some of these viruses replicate, I think the demand for 3-cell protease will continue to go up. And so that's where we're going to be targeting. And we're also going to be targeting, people who are interacting with a lot of other people and who want to support their immune system, such as athletes. And so, I have a background in football. And so we do have some relationships that we're going to be bringing to bear to increase the visibility around our 3-cell protease inhibitor products.
Absolutely. And then switching gears just a little bit as we wrap things up here. Last week, the Key Opinion Leader Conference, you mentioned a data lock was coming. Can we get an update with respect to timing? Can you also break down the process for that going forward?
Sure. So with regards to the data lock, that'll be out any day now. I just less than an hour ago got off the phone with our clinical team who's preparing all the work. We will be presenting data on the 26th of January at the Precision Medicine World Conference. So, and a press release will be going out about that sometime in the early part of January, so that our whole calendar for the month of January with respect to conferences will be out. So that's the date investors should really lock into, that we'll be presenting data. In terms of the data lock, the clinical data lock and the biomarker data lock, those those are almost finalized, and so we'll be having those locks out in the marketplace. But the date, of the results that will be out and presented will be the 26th of January. That's where the focus is. In the meantime, we're working towards finishing the agreement with NLC Pharma. We're almost done at this point. The lawyers are just wrapping things up, a few key due diligence items. We're waiting on some documents from various regulatory authorities with respect to certificates of good standing, et cetera. Some of that takes time over the holidays, but we're very much collaborating and working towards this data completion. We're very excited and very bullish on where we are with regards to the Tolavid data. Everything that we have so far gives us confidence that it will be successful, but until we have the data, obviously we don't have it. So that's the date, January 26th. And we're preparing everything towards that date.
Outstanding. Gerald Commissiong, the CEO of Todos Medical, as I said, always a pleasure to have you on. A lot of info packed into there. Excited to get this in front of our audience and excited to see what you guys do next. Thanks for joining us.
Thank you very much.